All right. Can you see?
Yeah.
Yeah. So the topic, as you noticed already, are tough questions. And today I will talk about the job of a journalist, the importance of key messages. What are the three S and why we should apply them? What is blocking and bridging technique? And this technique is the reason why I'm here today, to introduce you to something new that will help you in the future to protect you from the journalists and the tough questions, difficult ones. Mistakes during bridging. Here today I will only mention one that for me it's the most important. There are many more, of course, but I think for us, for now, this is the most important. And then teach you a little bit of ABCD technique. Okay? So I would like to start with this sentence from Humphrey. It is always a risk to speak to the press. They are likely to report what you say. Don't forget that. We always are paying attention in everything when we come to you. That is our job. Please. So here we have a general picture. So, in general, not only the doctors, we are afraid of talking with journalists. And we just saw why, right? Because sometimes journalists are not so nice the way they ask questions, and they really ask tough questions. And sometimes the doctors felt that at some point they were like disrespected or they were treated like unfairly. But any interview, it is a great opportunity to revert a difficult question, a prepared question from a journalist, into a positive message. For that, you need to prepare yourself. We are studying medicine, but in parallel to that, it is important that we learn how to, for example, block, bridge. These are, let's say, courses that help us how to manage any difficult situation that can happen in the future. So, be ready for any situation, prepare yourself, prepare the key messages so you can, let's say, during an interview, pass the message you wanna and not the message that the journalists wanna, okay? How? By practicing. Okay. So, a little bit of the function of a journalist. Journalism is a profession. And they want a story. And that story needs to be fresh. Needs to be interesting. Journalists will never understand your profession, like, fully. But you as a doctor as well will not understand journalists, to be honest. So, it's not the point. So, for their story, they need conflict and controversy. That's why one of you were saying, yeah, but I was trying to defend myself, but she cut my answer. She was asking, of course, I need something that will make the public enthusiastic about my notice, right? So, when I get a call that I have to go for a hospital or interview a doctor, of course, I will prepare myself as a journalist. I will write down my questions. So I have my angle of the story that I want to go through. So it's your job to make me to go around your angle of the story. So be focused, always. Avoid to get nervous. So if you stay on focused, you will never lose or get the feeling that you are yes, it's my responsibility, it's not my responsibility, it is. No, it's not, as it happened before. And of course, this is always the same cycle. Please. So the role of the message matter, as I said before, first of all, is keep in mind what matters is that you are able to pass the message that you have in your head. Okay? You want a positive message to be delivered for the person, the people that will be reading the news. When something happens in the hospital, in surgery, in emergency room, someone will call, can be family of your patient, the lawyers of the family or of your patient. So they are what we say opponent. And if they call the media, they are not afraid of them. Okay? They want everything to be exposed. They want you to pay for your mistakes. Right? So the fact that you will actually give the interview by not denying it will keep the story balanced. So the public will have both sides of the story. So don't hide, instead change what they perceive. Yes, please. So the truth, what is this? Is how we should behave when, are you reading? When we are talking to the press. First of all, we should be clear. We have to think that a child can be listening, a person that didn't study, so we need to be simple and use terms that every single person can understand them, like talking for a child. Okay, simple words. Confident. Remember, if a journalist comes to you as a doctor, talk about a mistake you have done. You were the one there, not the journalist. So you know more about your topic than any journalist, any person in the world. That is the way you have to always think. Because that actually will give you some confidence to manage the situation and what you will say to them. And in control, of course. That is something that all of us still need to learn, because otherwise, as you can see, the journalists can continuously make you feel like bad, a doctor that don't know what they are doing, that they are not professional, maybe that they are even liars, that they are there just to get paid in the end of the month, let's say. So remember, and this is a sentence that we listen, at least I listen here at SSST for 3 years already. There is no wrong questions, only wrong answers. Okay, please. So now, talking about blocking and bridging. This is a technique that is used not only by the doctors, but by any professional that needs at some point talk with journalists. How do we block? So, for example, I'm asking Ibrahim a difficult question. Ibrahim needs to be sure that he understood my question. Only by that way you will be able to give an answer. Here in Blocking, the answer should be like yes, no. Short answers that will show that you actually understood the question and you are preparing yourself to move for a fully answer. If you are being asked about the problem, the answer should be always about the solution. This is the way you take away the focus of me, but why, for something more that is like, okay, this is a problem, but we are thinking about the solution already, without blaming yourself, as a few of you did. Okay, I did it, my God, it's my fault. No, it's not that way as well. So never ignore the question. That is showing them that you respect as well their profession. Bridging is when, during the interview, you don't want to look like that you don't know about what the journalist is questioning you. That you don't want to look like rude by saying no comment, or I will not answer your question. This no comment actually is quite often if you read news or watch television. So it's what you do when you take a difficult question and you can transform it, and it will result in a positive and a prepared answer. It's used in any situation that you clearly explain your point of view to the other side. So this is just a scheme of what I said. We have a difficult question, any question that you are not sure how to answer it, but you still want to answer it. You bridge the question, and it will result in a positive message, means that the key message, a message that you want to transmit for everyone that is reading or listening your interview. So how we do it? We have this ABC, the technique. Acknowledge the question. As I said, when you understand the question, you are showing to the journalist that you understood and that you will answer it. And the short words or sentences, I mentioned it before, were like yes, no, I don't know. Then we have the bridging, and in the bridging is when we are changing the ambit of the question to the answer. And we use terms as but, however. What I can tell you is, what is important here is. Then we have the cover key message, that this is the part of the message that follows the bridging and needs to be clear and concise. And the dangle. The dangle is something that is not so often used. Let's say that you really need to know how to do it, okay? Because this is the part where, okay, the interview is going on, but comes to that part that you say, okay, now I want to make sure that you will not ask me anything about this topic, so I will be able to somehow change the topic or drive all this interview in another direction. For example, using a sentence like, what is really interesting is... Yes, please. So, as I said before, there are mistakes that all of us do in bridging, and for me it's really important, and for us as future doctors, that we understand that the worst thing can happen is not acknowledging the question, because it can result that the interview is not anymore about that specific subject, but becomes about ourselves, and we don't want the focus on us, right? So acknowledgement shows that you take the question seriously and that you admit that the question is legitimate. So remember, journalists will be satisfied with an answer that is not evasive. Okay? So to take home message, so always tell the truth. Be accessible, so talk with the journalists, say something. Of course, be ready, but show your face to them. Prepare and practice. There are courses, there are people that have more experience and can help you somehow. Stay calm. Again, when they come to you, they are asking about something related with what you are doing. So they don't understand of that as much as you do. Choose your words carefully, stay on message, avoid to get so nervous that then at a certain point you forgot what you wanted to say and then is a big confusion. Block and bridge and control your own news. That is the result that all of us wanted. So, and my last sentence for you. That is from a former White House spokesman. Treat them like professionals, and they will be your friends. Treat them like friends, and they will betray you every time. Thank you very much. And I enjoyed. I hope that you enjoyed as well. As the professor said before, I'm a fourth-year medical student, so anytime that you need anything, you just contact me, Instagram, Facebook, whenever. And I wish you a lot of luck and all good. Okay?
Thank you.